York City. I am your host, Matt Richards. Today, we're talking to Dr. Ted Long, the Senior Vice President of Ambulatory Care at New York City Health and Hospitals. Dr. Long is also the Executive Director of the NYC COVID-19 Test and Trace Corps, which has been vital to the tracing and mitigating of the spread of COVID-19 in our fantastic, vibrant city. Dr. Long is going to talk to us about moving forward and how we can start trying to get back to normal. But before that, we're going to highlight some of the amazing achievements of the Test and Trace program and hear directly from one of the contact tracers who's been working so hard to help slow the spread of COVID-19 here in New York. Stay tuned, because you don't want to miss this.
My name is Vishwajit Singh. One of the most rewarding aspects of being part of contact tracing teams in New York City is saving lives from COVID-19 pandemic. And that has been really rewarding, knowing that we are making a difference in saving New Yorkers from COVID-19 pandemic. The contact tracing effort in New York City actually has been a superheroic effort. With 4,000 plus team members, New Yorkers, we've come together as a community, as a team, as a city to suppress this pandemic. And it's taken a lot of thousands, millions of people working together to make that happen.
I got some questions for you, and
All
I
right.
know you got the answers.
I'll try my best.
Cool beans. All right. What is next? Where do we go from here?
So right now, everybody is so eager to get across that finish line and be done with the pandemic. We can see the light at the end of the tunnel, and I believe that we're on the final curve of COVID as we know it now. But that final curve is not over yet. We are not there yet. So where we go from here is we spend the next month buckling down and doubling our efforts for everything that we know works, that we as New Yorkers have done the whole way through. We need to keep getting tested. We need to get vaccinated. We need to plan to have one of the greatest summers New York City has ever seen. But we got to get there safely, because that will translate into saving lives between now and then.
I like that. Got another question. What new variants are out there? Because I've been hearing about the mutants, and I feel like I'm in an X-Men movie or something. All these mutations and variants.
Yeah, I hear you. So the variants, what that means is it's when the virus, as it was, mutates or changes a little bit. And the concerning part of that is, did it change so that it can evade what we're doing with the vaccines? I have some good news and some bad news for you. The good news is we do not believe, and we study this every single day, that the variants have mutated such that the vaccines won't work. We do believe strongly the vaccines do and will work. However, the bad news is the variants are more contagious. So, to use your X-Men analogy here, it's like we're in one of those movies where, again, we're nearing the end of the movie. We know the solution. It is the vaccine. No question about that. But then there's that last challenge that we have to overcome together. That's where we're at now, and that's why we need to use everything else in addition to the vaccine, continuing to get tested, talk to our contact tracers. That's how we get to the end of the movie, and we are near the end.
All right. Do we still need contact tracing?
I appreciate you asking about that. We need contact tracing now more than ever. What contact tracing does is it enables us to see where there's transmission happening. We see there's a case or somebody with COVID, and then we know who they could have infected, the contacts. We break those chains of transmission, though, by reaching out to the contacts. So contact tracing now is more important than ever, because we need to break all of those chains of transmission that we can to get us time for the vaccine to have its full effect.
How will this summer and fall compare to last summer and fall as it relates to the disease and the precautions we will need to take?
I believe this summer is going to be one of the greatest summers in New York's history, potentially in the history of humankind. We're going to fully vaccinate 5 million New Yorkers by the end of June. 5 million in a city of a little over 8 million. That's going to enable us to see what we can do to reopen the city further, and to let people do those things that, as you said, you're eager to do. What stands between now and then, making this summer the best summer in our history, is getting enough people vaccinated. We will vaccinate 5 million New Yorkers between now and when the summer starts at the end of June. But over the summer, too, we need to keep that effort going. The more people we get vaccinated, the better summer we're going to have.
Here's one for you. Will the Take Care program still be available later on this year and into 2022?
So for sure, the Take Care program, let me go ahead and define it for you there. It's going to be around as long as we need it. So the Take Care program is one of those New York flavors, if you will. Not everywhere has this, and actually we're one of the only places that has the hotels piece of it. So if you're a case, so you have COVID and you're contagious, or you've been exposed to somebody that was contagious, we'll put you up for free. We'll pick you up for free, put you up in one of our hotels for free, even give you free pajamas when you walk through the door and free meals delivered to your room 3 times a day. We want to make you comfortable. We want to make it a good experience for you. But when you decide to come to our hotel, that chain of transmission, when you would have potentially otherwise gone out there and infected 1 or more people, that chain is broken. Our hotel breaks chains of transmission and keeps our city safe. So we're going to keep using our hotels as long as we have the virus that's being transmitted in our communities. Other things that are unique about the Take Care program is we've listened. We've heard from our communities what they need in order to be successful staying at home. I'm a primary care doctor myself. I've diagnosed many of my patients in the Bronx, where I practice every week, with the coronavirus. And they ask me the same questions. Well, how do I get food for my family? Some have even asked, what about my dog? So our program, our Take Care program, will deliver food to you at your home. No problem at all. So you don't have to leave. You can make that smart decision for your family, your community, your city. We'll even walk your dog for free. We've listened and we're doing everything in our power. And if there's more we can do, let us know. We're there with you.
That's amazing. I didn't know about the dog walking.
See, there you go.
That is very impressive. What is the future of the New York City Test and Trace Corps?
So the New York City Test and Trace Corps, which again was able to hold down the virus more than any other place in the country, this past summer, we're going to do the same thing moving forward here. This summer, now we have the advantage of the vaccine, but we're going to keep our city safe. We're going to be here as long as you need us. As long as the virus is being transmitted, we will need to test people. We will need to contact trace people. Now, the vaccine is the end game there. Enough people get vaccinated, the virus will stop being transmitted like it is today. We're going to be there with you, with our city, keeping you as safe as possible between now and we get to that point. We're not going anywhere.
What do you want to be the legacy of the Test and Trace Corps in the fight against COVID-19?
Yeah, that's a really great question. I think the first thing that I would say is that what is the Test and Trace Corps? The Test and Trace Corps is 4,000 strong New Yorkers that have gone out there and said, we're going to keep our city safe. We're going to, many of them, hit the streets, track down people that are contagious or have been exposed. We're going to do everything in our power to protect our families, our communities, and our city. And I want people to remember about the Test and Trace Corps, that this was not 4,000 people that didn't understand New York City or from outside New York City. These are New Yorkers making sacrifices every day with their jobs to take care of New Yorkers. These are some of the hardest jobs in the world, but New Yorkers are doing this to keep our city safe, and that's what I want the legacy to be. In addition to that, just to go over a couple of accomplishments of what these 4,000 New Yorkers have been able to do. Back last March and April, so a year ago now, we saw COVID the worst of anywhere in the country, if not the world. We know how bad things can get. Our city is tough to control this thing. The virus can spread like wildfire in our city if left unchecked. And it did last March and April. We've never gone back there, and mark my words, we will not as long as we have the Test and Trace Corps. We actually, last summer, in the city that's one of the hardest places to control this thing, we did the best job of pretty much anywhere. We had 200 cases a day in a city of 8.3 million people. Our contact tracers earned that, and they kept our city safe. And then with our second wave here, if you compare us in New York City to the 5 largest states, we far and away had the lowest peak of new cases. We've been working so hard to keep our city safe, saving lives by keeping cases lower than other places. But then also, by the way, we reopened our economy, and we were the only big city in the country, the only one, to reopen our schools. As a father of 2 myself, being able to keep our city safe while being able to provide an in-person education to my kids, what's more important than that? Only New York did that, and our tracers deserve that to be their legacy.
Do we still need to get tested after completing the vaccine?
Good question. So if you've received the vaccine, you no longer need to get tested once a month, which has been our recommendation, unless you develop symptoms. If you develop symptoms that could be COVID, even if you've had the vaccine, then you should go out and get tested. In addition, there are some surveillance programs that exist that just test everybody in accordance with the CDC or Centers for Disease Control. If you're in one of those programs and your workplace is asking you to get tested, CDC recommends that you go ahead and get tested as part of that surveillance. But generally speaking, if you've been vaccinated, you've made a safe decision for yourself and your family and your city, so you don't need to get tested once a month like you used to.
Well, that's great news. All right. Thank you so much, Dr. Long. I appreciate you, taking time out of your busy day to answer some questions for me.
Anytime. It's a pleasure. Anytime.
Thank you so much, man.
All right.
Keep fighting the good fight.
I will. You too. We're all in this together.
Yes, sir. Thank you so much to Dr. Long for speaking with us and helping usher us into this new world. Thank you to our amazing contact tracer, Vishwajit, for all the invaluable work that the tracing team has done. Thank you to each and every New York City contact tracer for your hard work and the entire Test and Trace Corps for your tireless efforts throughout this crazy time. Thank you to our correspondents, to each of our guests, and of course, thank you for watching. I'm Matt Richards, and this has been NYC Let's Talk COVID. Stay safe, New York!